Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, focus on one condition that can live quietly in the body for years while doing very loud damage: hypertension. High blood pressure. Do not think of it as just a number. Think of it as the force of blood repeatedly striking the inner walls of the arteries every minute, every hour, every night while a person sleeps. Why does that matter? Because the arteries, the heart, the brain, the kidneys, and even the eyes are not built to tolerate excessive pressure forever. They can compensate for a while, they can stay silent for a while, but silence is not safety. The World Health Organization estimates that about 1.4 billion adults aged 30 to 79 worldwide had hypertension in 2024, and a large share of them did not know it. That is one of the most important facts to hold in your mind. Many people with high blood pressure do not feel sick. They go to work, eat dinner, laugh with family, and still carry a cardiovascular risk that is quietly growing. So ask yourself, why should small actions matter in a disease this serious? Why not wait for a major intervention? Why not depend only on medication? Here is the answer. Hypertension is often built by repeated daily signals: salt, stress, inactivity, poor sleep, alcohol, excess weight, missed medication, and inaccurate measurement. If repeated signals can push pressure upward, repeated small corrections can pull pressure downward. Do not underestimate the small step. Take it seriously. Measure correctly. Walk consistently. Reduce sodium. Sleep better. Take medication as prescribed. Speak with your clinician early. These are not minor gestures. They are pressure control tools. First, understand the number. Blood pressure has two main values. The top number, systolic pressure, reflects the force when the heart contracts. The bottom number, diastolic pressure, reflects the force when the heart relaxes. A single reading is not the full story. It is a snapshot. A pattern is the story. So here's the first command. Do not judge your blood pressure from one rushed reading. Sit properly. Rest. Measure again. Record the results. Why? Because blood pressure is easy to measure badly. A cough that is too small, an arm hanging down, talking during the reading, crossed legs, caffeine, stress, or measuring immediately after walking can all distort the number. The American Heart Association recommends an automatic upper arm cuff. The correct cuff size, 5 minutes of quiet rest, the arm supported at heart level, and taking multiple readings. How can something as simple as posture matter? Because the measurement is not just a technical ritual, it is the foundation of the diagnosis. If the number is wrong, the decision may be wrong. A falsely high reading can create fear. A falsely low reading can create false comfort. So measure like a professional at home. Sit with your back supported, feet flat, cuff on bare skin, no talking, and take 2 readings 1 minute apart. Write them down. Bring them to your clinician. Now ask, why is hypertension so dangerous if people often feel nothing? Because pressure damages through repetition. Imagine bending a paperclip once. Nothing happens. Bend it thousands of times. It weakens. Arteries respond in a similar long-term way. High pressure injures the vessel lining, stiffens arteries, increases the workload of the heart, and raises the risk of stroke, heart failure, kidney disease, and premature death. The CDC reports that high blood pressure increases the risk for heart disease and stroke, and in the United States it was a primary or contributing cause of hundreds of thousands of deaths in 2024. Now, do not hear this as fear. Hear it as leverage. If blood pressure is a repeated force, then repeated small changes have power. Start with sodium. Here is the command. Look at the sodium line on food labels before you look at calories. Why? Because much of the sodium people consume does not come from the salt shaker. It comes hidden inside bread, sauces, soups, deli meats, packaged meals, restaurant food, and snacks. A meal may not taste salty and still deliver a large sodium load. How does sodium raise blood pressure? Sodium pulls water into the circulation. More fluid means more volume in the blood vessels. More volume can mean higher pressure. In some people, especially those who are salt sensitive, this effect is strong. The 2024 European Society of Cardiology guidance emphasizes reducing dietary salt for people with elevated blood pressure and hypertension, and the American Heart Association also advises choosing foods lower in sodium as part of blood pressure control. So make it concrete. Do not say, "I will eat healthier someday." Say this: "This week, I will replace one high-sodium food I eat often. Replace processed lunch meat with grilled chicken or beans. Replace instant noodles with a bowl built from vegetables, protein, and a lower sodium base. Replace salty snacks with fruit, yogurt, nuts without added salt, or cut vegetables." Ask yourself, how can one substitution matter? Because one substitution repeated daily becomes 365 substitutions in a year. That is how blood pressure changes, not through drama, but through repetition. Next, build the plate. Use the DASH pattern. Dietary approaches to stop hypertension. Do not treat it as a diet trend. Treat it as a clinical tool made of food. It emphasizes vegetables, fruits, low-fat dairy, legumes, nuts, whole grains, fish, and poultry while reducing saturated fat, sweets, and excess sodium. A systematic review and meta-analysis of randomized controlled trials found that DASH lowered systolic and diastolic blood pressure compared with control diets. Why does this work? Because DASH changes several biological signals at once. It increases potassium, magnesium, calcium, fiber, and nitrate-rich plant foods. It reduces sodium and saturated fat. It improves vascular function. It supports weight control without requiring a person to count every crumb. How should you begin? Do not redesign your whole life overnight. Add before you subtract. Add one fruit daily. Add one vegetable at lunch and dinner. Add beans twice weekly. Add oatmeal or whole grains. Then remove what is pushing pressure upward: excess sodium, sugary drinks, heavy alcohol, and ultra-processed meals. But listen carefully. If you have kidney disease, take certain blood pressure medicines, or have been told to limit potassium, do not suddenly add potassium supplements or salt substitutes without medical guidance. Ask your clinician. Be disciplined, not reckless. Now move the body. Here is the command: walk after meals when you can. Train your muscles. Stand up from long sitting. Make movement a prescription, not a mood. Why does exercise lower blood pressure? During physical activity, blood vessels learn to widen more effectively. The nervous system becomes less overactive. Insulin sensitivity improves. Weight may decrease. Arterial stiffness may improve. The heart becomes more capable of doing its work with less strain. How much movement is enough? Begin with what you can repeat. 10 minutes after lunch, 10 minutes after dinner, 5 minutes of stairs, a short brisk walk, a chair-based routine. The key is not perfection. The key is repeatability. There is also a detail many people have not heard. Some analyses have found strong blood pressure reductions from isometric exercise training, such as wall sits or hand grip style training, when done appropriately and consistently. A large network meta-analysis published in the British Journal of Sports Medicine ranked isometric exercise training highly for lowering resting blood pressure while still supporting aerobic and resistance exercise as valuable. How should you use that? Carefully. Do not strain, hold your breath, or turn exercise into a contest. If you have heart disease, severe uncontrolled hypertension, dizziness, chest pain, or are new to exercise, get medical advice first. But for many people, a simple plan can help. Walk most days, add light resistance training 2 or 3 times weekly, and consider brief supervised or properly taught isometric work. Now address weight without shame. Do not insult the body. Do not motivate people through humiliation. Hypertension care must be precise and compassionate. Excess body weight can increase blood pressure through inflammation, insulin resistance, sleep apnea, increased blood volume, and hormonal changes involving the kidneys and blood vessels. But even modest weight loss can help some people reduce blood pressure. Ask, how do we make weight change possible? Not by saying, try harder. Say, design the environment. Put fruit where you can see it. Keep salty snacks out of daily reach. Prepare protein ahead of time. Use smaller plates if portions are drifting. Drink water before the second serving. Sleep enough so hunger hormones are not fighting you. Now sleep. Do not treat sleep as optional. Ask yourself, why does blood pressure often remain high when someone eats well and takes medicine? One hidden reason can be poor sleep, especially obstructive sleep apnea. Snoring, gasping, morning headaches, daytime sleepiness, resistant hypertension, and large neck circumference should raise attention. At night, blood pressure is supposed to dip. If breathing repeatedly stops, oxygen falls, adrenaline rises, and the cardiovascular system stays under alarm. How do you act? Tell your clinician if you snore heavily or wake up choking. Ask whether sleep evaluation is appropriate. Reduce late alcohol. Keep a consistent sleep schedule. Protect the bedroom from constant light and noise. Sleep is not laziness, it is vascular recovery. Now alcohol. Give this command. If you do not drink, do not start for your heart. If you do drink, reduce the amount. Alcohol can raise blood pressure, disturb sleep, increase calories, and interact with medications. Many people think the issue is only heavy drinking, but blood pressure can respond to smaller reductions, especially in those drinking regularly. The American Heart Association advises limiting alcohol and emphasizes diet and lifestyle as central to cardiovascular prevention and management. How do you make reduction easier? Create rules before the evening begins. Do not decide after the first drink. Choose alcohol-free days. Use smaller glasses. Alternate with water. Tell a friend or family member your plan. Make the healthy choice visible. Now medication. Here is a crucial command. Do not stop prescribed blood pressure medication just because one reading looks better. Blood pressure improves because the plan is working. Stopping the plan can allow pressure to rise again. Why are medicines sometimes necessary even when lifestyle improves? Because hypertension may involve genetics, aging arteries, kidney regulation, hormonal pathways, diabetes, chronic kidney disease, or long-standing vascular stiffness. Lifestyle is foundational, but it is not always enough alone. The 2025 high blood pressure guideline from major US cardiovascular and medical organizations recommends lifestyle interventions across blood pressure categories and medication for adults at higher levels or higher cardiovascular risk. How can small actions improve medication success? Use a pill organizer. Link the dose to a daily habit, like brushing teeth. Set a phone reminder. Refill early. Ask about side effects instead of silently quitting. If cost is a problem, say so. If dizziness occurs, say so. If home readings are dropping, show the log. Treatment should be adjusted with evidence, not guesswork. Remember the S-Print trial. In adults at high cardiovascular risk, without diabetes or prior stroke, intensive systolic blood pressure treatment produced lower rates of major cardiovascular outcomes and death compared with standard treatment, though intensive treatment also requires careful monitoring for side effects. Why mention this? Because numbers are not abstract. Lowering blood pressure in the right patient with the right supervision can prevent events that change families forever. Now stress. Do not say, just relax. That phrase helps almost no one. Instead, give the nervous system a method. Try this. Inhale slowly, exhale longer than you inhale, and repeat for 2 to 5 minutes. Why? Slow breathing can reduce sympathetic nervous system tone, the fight or flight signal that tightens blood vessels and raises heart rate. It is not a replacement for medication, diet, or medical care, but it can become a useful daily reset. How should people use it? Before measuring blood pressure, before sleep, before responding to an argument, before eating quickly after a hard day. Small pauses protect choices. Now connect everything. Measure accurately, reduce sodium, Eat in a DASH-style pattern, move daily, sleep deliberately, reduce alcohol, take medication correctly, manage stress with a repeatable technique, follow up. Do not try to become a perfect patient, become a consistent one. Ask, why do small actions work? Because blood pressure is dynamic. It responds to volume, vessel tone, hormones, kidney handling of sodium, nervous system activity, sleep quality, weight, and medication adherence. Small actions touch these systems repeatedly. Ask, how do we make the plan last? Make it small enough to repeat, visible enough to remember, and meaningful enough to protect. Do not say, I will change everything. Say, I will take my pressure correctly 3 mornings this week. Say, I will walk 10 minutes after dinner. Say, I will check sodium before buying. Say, I will not miss my medication. Say, I will call my clinician instead of guessing. Let us close with this image. Hypertension is not always a storm. Often, it is a quiet drip against stone. But small actions are also a drip. Steady, controlled, intentional, and over time, they can reshape risk. So begin today. Measure correctly. Choose one lower sodium swap. Take one walk. Prepare one better meal. Sleep with purpose. Take your medication as prescribed. Ask for help early. Bring your numbers to someone who can interpret them. Why? Because a lower blood pressure number is not just a cleaner chart. It is more protected brain tissue. It is less strain on the heart. It is safer kidneys. It is more years of clear mornings, family meals, ordinary laughter, and being present for people who need you. How do we fight hypertension? Not only with big decisions in clinics, but with small actions repeated at home. Take care of yourselves and take care of one another. We are learning this together like a family. See you in the next topic.